Dr. Rathmell, thank you for finding the time to talk with me. For historians among us, this is a historic day. This is Dr. Rathmell's first day at Ohio State. So that's all. Again, thank you for finding the time to talk with me. I'm sure it was hectic.
It was a really good day, I have to say. We're for those who don't know, we're at the end of the day, and I've had a broad introduction, and people have been fantastic.
Oh, that's great. Actually, we should say, since for the historians among us, again, this is May 27th that we're of 2025. So anyway, I guess it's really fascinating to ask you what it's like out there outside NCI. So after stepping down, after the American people got the raw deal of not keeping you for 10 years as the NCI director, what was it like? What have you learned? What is the point of, what is the lesson learned from your excellent adventures in Bethesda?
Oh, well, so first I have to say that time that I spent at the NCI was thrilling, and it was absolutely captivating to be a part of such a huge and tremendous mission. So I loved every minute of my time at the NCI. So I also have to, thank you for the opportunity to spend some time writing some columns, because I did have to process that transition. It was a time for me to really think about what my priorities are, what really makes me motivated. Many of us in academia never spend a period of time outside of employment, and having that chance to think about what do I want to really do with the skill set that I've developed, the opportunities, the network that I have to make the biggest difference. And to me, making a big difference is really, really important. And so that time gave me a chance to really process, and I did this in front of almost everyone at the Cancer Letter, and got to write about, sort of synthesizing my values around career development and training, around the importance of community and access to care, the importance of really bold discovery, and where can you find all of those pieces together. So that was my journey over the last couple of months.
That took a lot of bravery. Some of these pieces, I just was looking at them and I'm saying, oh my God, that is brave. And this is actually what everybody really needed to hear, the level of honesty of this, like the story about your father's suicide, my God, and how important it is to think that we're more than just our jobs.
Yeah, that one was one I wrote, I felt really compelled to write, because I really wanted people to feel, that this is something we should address, is when people have a major stressor, particularly coming in their intersection of their professional and personal lives, that it can be very serious. It's not a story that I had actually shared very publicly ever before. And I, again, I'm glad that I chose to write it. I've gotten a lot of feedback from people who recognized that sort of tension and stressors in even themselves or around them, and that's the purpose is to really allow for that kind of vulnerability and communication.
Yeah, I would say it's one of the most memorable pieces we've ever published in the Cancer Letter. So, and I guess, how does this sort of learning, how does this process work? How do you go? What do you take from the NCI director's job to your new job at Ohio State?
Yeah, well, the opportunity at the Ohio State came, amidst looking at lots of different ways that I could apply this sort of idea of a big mission. But it was really when I was articulating, I want a big mission and something where we can make a big difference, that as I was getting to know the folks at Ohio State, was realizing, one, this is a big place. This is the third largest cancer hospital in the country. This is one of the largest public schools for higher education. You know, the bigness is a big part of it, and also simultaneously found that the same desire to serve the citizens of Ohio, to find ways that we can provide access to care, good quality screening, detection, care for people from all over the state, is really an ecosystem to study how we do this well on a national level. So to me, it's an extension of what I was doing on a national level. Even though I'm moving into a state, it's a place where you have bigger control of the levers. And so I'm really just excited to see what we can do to just improve health in this giant laboratory of Ohio.
But I mean, you grew up around cancer centers your whole career, so it's kind of more of a homecoming than not. Maybe we should just talk more about the job and what it is, how Ohio State operates. How does this work with the cancer center director's job as well, and just maybe the whole kind of diagram, if you could do it.
Yeah, well, I'll start with saying that I'm still learning a lot about how Ohio State works, and it is the first day on the job, and so I'm still making sure I understand all of how the pieces and parts fit together. The things that I really love in this job is that this is the CEO job. So this is the cancer hospital, making sure that we, provide really exceptional care, and that we are, serving that mission. And so that's number one. But it also encompasses the research arm, and so those things are really tightly knit together. And to me, that's really important. One of the things that I loved being able to articulate, I loved it long before, but to articulate when I was with the NCI, was how much more power there is to work in the spaces between, clinical care and clinical research, right? That's where magic happens. And that's also where you can be most powerful, to have the most impactful research questions and have that research inform clinical care in what is a truly learning healthcare system. So that's what this is about. And then especially to me, to be a part of a place where there's phenomenal training. I mean, I'm really, really thrilled to be back in the saddle with medical students and undergraduates and PhD students and postdocs, and also with the opportunity to be a practicing physician. And I have a big enough position to have this whole umbrella, but with enough bandwidth that I'll be able to work in the trenches, so to speak.
So you'll actually go and see patients?
I will. My plan to start is to see patients on a consultative basis. So it's a big hospital with lots of opportunity to do consult care. Okay.
Wow.
Yeah. Wow. There are 24 hours in a day. I'm still very aware of the laws of physics, and so I'll be working within those constraints. But
within those constraints, my God, that's even hard to imagine, because how large is this? Because you mentioned it's the third largest. I guess what's the first? What's the second?
So I think I'm not sure who's first and who's second, but we're talking about MD Anderson and Memorial Sloan Kettering, but we're number 3.
Number 3, my God! So
and growing, though. I will say that we have a new cancer hospital with roughly 150 beds that will be opening up in the spring. So we're big and we'll be bigger.
My God, that's really enormous. Most of my friends who become cancer center directors call this drinking out of a fire hose. What worries you right now? It's right now the most. given what's happening in Washington?
Well, so it's day one. It is drinking from a fire hose. Today has been just phenomenal with learning about new things that we do here at the Ohio State that I wasn't even aware of in terms of scale of care for patients and research opportunities, and got to see some of what we're doing with community outreach and engagement. I think all of these things are really important, and I am looking for where there are sort of the best opportunities to grow, where there are the kinds of programs that can have the biggest impact, so that we can make those kinds of investments. I think that I said this when I was NCI director. I would say it again every day, that investment in cancer research from any source is the best investment that you can make. There's well-documented numbers suggesting, $2.50 for every dollar that's spent. It's probably more than that in terms of the kinds of gains when you talk about things that are commercialized and life saved, and increased productivity, increased well-being. So I'm really, yes, drinking from a fire hose, really, really excited about all the things that there are to learn about, and want to make sure that we are able to continue to make those kinds of investments.
Mm-hmm. Well, what about community outreach and engagement? You mentioned that.
A big draw for me to come to the James was how strong the community outreach and engagement is here. So for sure here it's front and center and very strong and very well developed. I got a chance briefly, but to meet with the team today and to hear from the community outreach leaders and their staff, and to hear from them about what some of the biggest issues are that they're dealing with. Ohio is a great ecosystem for us to work in. Number one, I'm really interested in how we deliver healthcare to rural America. It's a huge issue. The great expanses of distance and providing specialty care to people who live all over our country, really important to me. That stems from my Iowa upbringing, probably, but just looking at some of our data when I was at the NCI, that's a huge issue to tackle. Here we also have the added complexity of Appalachia and areas that are even more remote and harder to access. And we have cities and urban areas. We have areas of persistent poverty, and we have immigrant populations and individuals from all over the world who bring the complexities around language barriers, as well as expectations and cultural barriers, and trying to provide really the best cancer health care in all of these areas. This is, we learn to do this in Ohio. We will do this nationwide and worldwide.
There's no real, there's the prohibitions against DEI, and there's always this fear that COE might fall by the wayside. Actually, there is one thing: the registries, the cancer registries that CDC has been operating for a long time, 30 years, longer. And what happens? Does that affect you in Ohio yet, or the fact that they may be closing that down?
This is going to be one of the questions that I have to say day one. I don't know the answer.
You haven't drunk that.
So that hasn't been part of my day one briefing yet.
Yeah. I'm just. Yes, so I'm sure you would be able to figure out how to fill in the blanks there, or what's missing of the table.
I always believe that data is important, that knowing the information in both the time and the geography is absolutely valuable. So.
Yeah, and what about Medicare and Medicaid? Is that part of the drinking out of the fire hose today?
Also was not part of day one briefing. So okay. I will enjoy that one in a few days, I'm sure.
Yeah, I'm sure. It's also not really, as of May 27, 2025, it's not really clear whether this should have been a part of your there was nothing to talk about as part of the briefing. It's not really happened yet. and
Right.
may not happen, God willing.
We'll be watching things really carefully. We will be, attentive to changes should they come, and we'll be, responding accordingly in a coordinated fashion. That I can actually absolutely assure you of.
I was just talking to Steve Labuti actually fairly recently about the cancer center they've just built at Rutgers. And he said that without NCI, this thing is just nothing. It's not useful. You need to have NCI at the center of it all. Do you feel the same way at Ohio State? Do you think Ohio State is big enough that it has critical mass to function without NCI, at least for a while?
So that's very hard for me to imagine, having been the NCI director, to conceive of a world where the NCI isn't supporting things. So I'll start there. I think that I have definitely seen over and over again the Cancer Center program bring people together in ways that were not impossible before, but are much more natural and sturdy because of the Cancer Center program. So to me, this is one of the gems of the NCI, but of the NIH in general, is the Cancer Center program. It really provides for not only institutions to be able to span that whole breadth from tracking cases to clinical trials and basic science and training, and make sure that you're doing all of it at the very top level. But when you do that, you're providing a resource for your city, your region, your state, and your nation. So it's such a valuable part of an ecosystem. It is really just. It is front and center. So I can see where that comment came from. We value that, and we lean on this kind of mechanism to bring all of those pieces together.
Mm-hmm. It's a kind of a coordinating piece of it and a strategic piece of it. And it is. It helps to elevate the value in studying cancer. It's preaching from the choir to say that cancer is the best field to be in, but cancer is really central because it touches everything else, right? If you invest in cancer, you're by natural extent you're investing in foundational basic science. You're investing in good pathology and radiology and patient support services, and those are good for all of the healthcare system. And so the cancer centers have really just allowed a emergence in our health system to be stronger because of an investment that is really focused mostly on research, but it's done so much more than that. Mm-hmm. Yeah, it's really hard to imagine the world without NCI. Oh, here's another question. Would you say that there is any waste at NCI? Would you say that there's a reason to even how much of the NCI is essential? How much can you cut? Let me just rephrase the question so I wouldn't start another way. How much can you cut within NCI and not start amputating limbs or endangering the life of the institute? You've seen it, you know it closer than anybody right now.
Yeah, and I would also I would say we when I was the NCI director, we proposed a budget that was significantly higher. There are an enormous number of opportunities in the cancer space, and there's not any component that's not worthy of its investment. And I think that it's I think it's important to understand all of these components, why they fit in, and where they are valuable. And I think I'll stop with that.
So you would not see that there's any reason to cut anything, which has been happening. So, yeah. What's looking at funding for cancer research? Is there any other place other than the government that can take the role that NCI is playing, or the funding role for that matter? Is there another way? Is there a funding stream waiting somewhere that we haven't noticed yet?
So there are. I think we're all trying to look at how we fund this really valuable research, in particular how we manage to sustain, particularly our early career investigators. Right, we cannot afford to lose a generation of researchers. So in looking at how you fund a research program, there are opportunities to look at foundations and other sources of support. One of the things that drew me very much to the Ohio State was the incredible support that they get from the community. The hallmark of that is the Pelotonia event and the Pelotonia organization, which not only provides a substantial level of support for research, it specifically funds early career investigators and young people, enables graduate students to work on projects in the cancer space, and can help with some really large kinds of initiatives, like our Pelotonia Institute for Immuno-Oncology, just as an example. So I don't think that we can say that there's sort of one additional funding stream. We do need to be thinking very creatively about partnerships and thinking about how we engage with industry and biotech, how we frankly think about partnering with insurance companies and other important parts of our whole healthcare and research ecosystem, because the questions are too important. Patients are counting on us, and there are, and we're at this. This remains the best time to be involved in cancer research. I will say that every single day, and it's because the technology is amazing. The kinds of things that we can address with questions. I mean, I've said this before, and people say it. We can now study in patients things that previously, before we could only try to guess at. There are discoveries we can make in real time that will change and impact patients like next year and the year after, not decades from now, not in another generation. So those kinds of things are what motivates us and keep us going, but we can also be thinking really creatively about how we make sure that we're keeping those things going forward.
We haven't heard from patients yet. I know it's just beginning, this period of whatever you want to call it. We really haven't heard patients say, "Hey, this has hurt me." And I think it's probably time.
Well, this is where the community outreach and engagement is important, to be hearing from patients, hearing from communities, understanding where their pain points are, knowing where any of what we're doing is impacting people, either in individual level or community level. And creating those kinds of conduits so that we can hear from people is super important.
Mm-hmm. Yeah, it would be awfully useful to hear it here in Washington. It's not, you're of course talking about policy, you're talking about being able to calibrate your response as a public health agency in some ways, but also as a political voice. That voice has not yet been heard, but then again, it's just begun.
Yeah, these levels of dialogue need to happen on all bases. So I will throw one more in as well, which is understanding, how we make research decisions and how we do even in the basic sciences, connecting that back to patients and what patients are most interested in, I think is just invaluable. I'm just going to make one quick plug for a session at ASCO that I helped to put together that I'm chairing on.
I'd love to hear that.
Cancer. Yeah, so it's an early onset cancer. It's on Monday morning. So if anybody's up early and wants to come here, it's going to be a fantastic session. So we're going to be talking about the state of early onset cancer in the epidemiology, the science, and how to develop a clinic that is responsive to the needs of early onset cancer patients. But the best of those talks, I think, is going to be from a patient herself, who I asked to come and talk about, not tell us what it is that patients want doctors and scientists to know. What are you looking for? What are the things that feel like we're missing? And speak about that. And then we're going to take it and have a good long period of time for question and answer, which I am hoping turns into a conversation like we're at a dinner table, because this is a topic that is just important to everyone. But I bring it up not just to plug the session, but because it was so important to us that we have a patient voice at that table equal to all of the scientists and doctors who are also presenting.
No, that's very helpful. But as a scientist, do you see this as a very real thing, the top line that this is happening, or is it anecdotal? Is there a way to measure how much of that actually is real?
It is, and there's a good paper that just came out from Meredith Shields at the NCI, really cataloging like what is the excess number of cancers that we're dealing with and what cancers are being affected. It's I think just putting data, again, I think data is absolutely important for making good, sound decision making. And if we can put the data out there so people can see, what cancers are on the rise, how steeply, where is it rising, and then we can then start to peel back those layers. Are those cancers looking like they're different molecularly? Are they behaving in some other different way? So that this will give us clues as to how we understand the emergence of cancer, not just for young people, but I think for everyone. And this subgroup gives us opportunities as well to understand better how we diagnose and treat cancer patients. So it's a real number. It's a significant departure from where things were before. Cancer's always changed and evolved with the times, but this is one that both is part of some evolution that's happening, but that because it's happening in young people, the opportunity to impact lives, many, many years of life, years of productive life, is just so rich that it's really, really worth the investment.
Speaking of younger people, I'm sure you haven't run into a lot of junior faculty members yet, but what is your message to them? How can they stay, and how can you help them stay in the field now that I would think that your chances of getting your first R01 have probably decreased significantly or about to, and money is scarce.
So when money may be scarce, but the ideas are not. There are great ideas out there. I would encourage anyone who is interested in this career path to really double down on really the boldest ideas are the ones that are going to be funded, and to do innovative work and to be enthusiastic about the work that they're doing. the need for cancer researchers has not gone away, and we need young cancer researchers to be in the field. That's my pitch. We need people who are bringing fresh ideas, who are seeing things with different perspective, who can be a part of the transformation of healthcare, which is going to come. This is an important time on many different levels. The rise of AI in the work that we do, the utilization of data in very, very different ways, the kinds of technologies that we're going to be bringing to bear. We need young minds in that space as we move forward. So, and it's important to know our history as well, that there have been times where our funding has been constrained in the past. And so not to think that this is some sign that this is over. This is not a time to abandon what is a really fantastic career path and really meaningful. I mean, I'm back here doing this after a period of time away because it's a real mission. It's really valuable, and you can see that value in your patient every day and the student that you work with, but so increasingly in changes in health. And that's just not something that you can replicate in any other way.
Mm-hmm. Well, I don't think I've ever actually seen it drop by as much as they're talking about. There have been a few little, there was one particular cut on Harold Varmus's watch, but mostly it's been up. I mean, with bird pie, yeah, you can argue that it's been inflation, all of that, yes. But this is something new. I don't think I've ever seen that, and I've been covering for a long time. But how do you keep them in there? I mean, encouragement is great, but should there be a mechanism? I mean, it's certainly not something you can put together by yourself at Ohio State, but should there be some mechanism for keeping people just at least functioning in this while this period goes on?
So supporting particularly young people is absolutely essential. And again, I'll point to the support that, for example, at the Ohio State that we get from the Palatania for student support, for early career investigators. We're seeing in some of our partnering foundations, expansion is particularly around grants for those in the early career stage. I'm delighted to see that, and I think we'll be, doing the best that we can to keep supporting. But I will just double down on it. It's people in that early career stage that I think we need to support most important.
Yeah, I would love to continue to kind of look at how it happens. I know it's a terrible question to be asking on your first day. What are you going to do about young investigators at Ohio State, Dr. Rathmell? But it's a national issue, and you would think that lots of people should be really thinking about it. You recently wrote that we're in an era of cancer prevention. What is your thinking about prevention now in this state of austerity? What can you prevent?
Well, I'm really glad you asked, and I think of prevention as the best way to manage a cancer is to never have a cancer, and we have tools that were never at our fingertips before to be able to prevent cancers or detect them early. And I'm going to lump those together. And I know that there are reasons they can be separated effectively, but the kinds of things that we're able to look at with, novel imaging, and let me just back up. Let me start with what we have, tried and true. Smoking cessation, working on obesity as a risk factor, thinking about alcohol. All of those things, we have so much more data than we had before, and really good evidence for how we can make a big difference in that space, and data that it actually does. Huge, measurable changes in cancer incidence. But our screening now, mammography, multiple ways to screen for colon cancer, screening for cervical cancer, screening for, and I should put that in prevention as well, screening for lung cancer. Those are things that have been, evolving in lots of different spaces, suddenly in a place where we can bring them all together in much more cohesive ways to help people own their health. So when I say that this is ready for an era of prevention, to me it's a place where people can understand their risk, can understand. Soon we'll know more individually about all of our own genetics, right? And know about our own risk because of our modifiable behavioral patterns, smoking, alcohol, etc. We know about our family. We'll know about what we should be thinking in terms of risk, and then able to take action, able to manage our own prevention and manage our own early detection, so that the metastatic cancer becomes much less of a big problem. So, I'm looking at some of these. This is where I started at the end rather than at the beginning. Really excited about novel ways that we do imaging that's lower risk to be able to identify tumors. I'm also really excited to think about what multi-cancer detection tests are going to do for us, and liquid biopsy, blood-based testing, and ways that we can learn how to define new risk categories so that we can do the best job of taking care of people's health. So to me, that's the era that we're moving into.
What's on your list of presentations to see at ASCO? What's the practice-changing stuff coming down?
Oh, I always feel like I know what's practice-changing after ASCO, so I'm going to visit lots and lots of different talks. I always really enjoy going to the plenaries. Those get picked for a reason, and they always do just a phenomenal job of helping to showcase the newest, really exciting technologies and ways that we can take cancer to a different level.
I guess is there anything I forgot to ask?
I don't think so, actually. I think we pretty much covered everything for my first day. So, the only thing that I'll just want to make sure I say is that I'm really excited to be, back in it and really thinking about cancer problems that we can take on full force straight ahead. So I'm really delighted to be here.
Thank you very much.
Yeah.